My name is Dr. Raul Lopez. I am the medical director at Cerritos College Health Center, and I'm vaccinated against COVID-19. So one of the big questions that we're hearing, that I'm hearing during this pandemic, especially now that we're administering vaccines, is whether or not the vaccine will change an individual's DNA. The answer to that is no. Vaccines, when they're administered, are administered to mount an immune response. They never enter your cells, and specifically they never enter the nucleus of the cells where the DNA is made. Vaccines are pretty effective and by no means will alter your DNA. They have no role in altering any cell structure. The answer to that is no. Vaccines have been around for many decades now, and the vaccine that we have for COVID-19, once again, does not alter your DNA and does not affect any cell replication. Therefore, there's no association with sterility. They do not cause sterility in men or women. The question is no, there's no microchips in the vaccine. The method by which the vaccines were approved makes it scientifically impossible to place any microchips into the vaccine. The one thing that you should be more concerned about is not the vaccine, but this is what's tracking you. The administration of a COVID-19 vaccine, just like any other vaccine or taking any other medications for that matter, has an inherent risk. When you take the COVID vaccine, there's a 1 to 100,000 chance that you could have what's called a severe allergic reaction or anaphylaxis. If that's the case, individuals who receive the vaccine, they are observed for 15 to 30 minutes to make sure that none of this reaction takes place. In the event that it does take place, then the professionals at the vaccine centers are prepared to respond to any such emergency. The COVID-19 vaccines that are out now are very safe. The technology that has been employed to develop the vaccines has been around for many decades. When speaking about the Pfizer and the Moderna vaccine, that technology has been around for more than 3 decades, and that technology we use for the treatment of certain cancers. The other vaccines, the Johnson & Johnson and the AstraZeneca vaccine, that technology that was used to develop those vaccines has been around for many decades also and is relatively safe also. There are some side effects in some individuals who receive the COVID-19 vaccine. The most common side effects will be pain and bruising to the injection site, which usually happens about several hours to 1 or 2 days after the administration of that vaccine. Other common side effects, which is more common with the second dose of both the Pfizer and the Moderna vaccine, happen about 12 hours after the second dose, and those side effects can include just body pain, headache, just weakness, and sometimes a fever is associated with it. My recommendation is that you take over-the-counter medications for pain and fever. If you have any concerns where symptoms persist, or you're concerned that there might be something else going on and they're not side effects related to the vaccine, then I suggest that you contact your physician or go to the local emergency room. The COVID-19 vaccines are very safe. You are going to hear from different individuals, different stories about vaccines and their experiences with vaccines. These vaccines have been through very rigorous certification and are safe. At the end of the day, the most important thing that I recommend is that you self-educate yourself about the safety of vaccines, and you'll find that they're very effective and safe. You're always going to hear comments from even your parents or other individuals who are important in your life, and their concept or their idea about vaccines may differ, but my recommendation is to make your own decision by doing your own research and finding out that vaccines are safe. The COVID-19 vaccines are very effective and safe. All the research that has been done on them has proven their safety. When making a decision to get the vaccine, please look to the most reputable sources for your information. We want this pandemic to be over. We need your assistance. Getting vaccinated will curb this pandemic and get us back to where we were once. Please go out and get vaccinated.